Anemia is one of the most common problems in medicine. The difficulty is usually not in recognizing anemia, it's in understanding the causes of anemia. Before we get into individual anemias, it's important that we classify anemia into a sensible framework. In this video, we'll define anemia and see how it is classified. I'm Nabeel, this is Pathologist. Anemia is defined as reduction in red blood cell mass. Since RBCs carry hemoglobin, reduction of RBCs causes reduced hemoglobin, which reduces the oxygen carrying capacity of the blood, which in turn causes tissue hypoxia. Clinically, the effects of anemia are really effects of tissue hypoxia. In theory, anemia refers to red blood cell mass, but practically it's difficult to measure red blood cell mass. So, on ground, we use hemoglobin and hematocrit. So, anemia is reduction of hemoglobin and hematocrit. These usually correlate well with red blood cell mass, except in conditions where plasma volume changes, like fluid overload, dehydration, etc. There are many ways to classify anemia. Two approaches are particularly useful. One is mechanism based. The other is morphology based. Robbins primarily classifies anemia based on mechanism. Based on underlying mechanism, anemia can be classified into three. One is anemia due to blood loss. Then anemia due to reduced production of red blood cells. And then increased destruction of RBCs. Every anemia can be placed into one or more of these categories. Anemia due to blood loss can be acute, like in cases of trauma, surgery, etc. Or it can be chronic, like gastrointestinal blood loss, gynecological blood loss, etc. The major problem in chronic blood loss is loss of iron. Now let's look at anemia due to reduced production. Here, bone marrow fails to produce enough RBCs. It can be due to nutritional deficiency, like in cases of iron deficiency, where hemoglobin synthesis is affected, or in cases of folate or B12 deficiency, where DNA synthesis is affected. Renal failure reduces erythropoietin, which in turn reduces the production of RBCs. Now, if bone marrow is infiltrated by malignancies or infections like tuberculosis, space inside the bone marrow reduces, which in turn reduces the production of RBCs. In aplastic anemia, the marrow fails to produce cells. Now let's look at the group where RBCs are normally produced but destroyed prematurely. These anemias are called hemolytic anemias. They can be inherited or acquired. Inherited anemias can be due to membrane defect as in hereditary spherocytosis, enzyme defect as in G6PD deficiency, reduced globin synthesis in thalassemia, or structurally abnormal hemoglobin like in sickle cell anemia. Acquired hemolytic anemias can be secondary to mechanical destruction of RBCs because of microangiopathic hemolysis or antibodies against RBCs like in autoimmune hemolytic anemia or infection of the red cells like in malaria. Clinically, anemias are often approached based on morphology, which includes size, shape, and color. Microcytic hypochromic anemia where RBCs are reduced in size and the color is less, is usually due to defect in hemoglobin synthesis. Whereas macrocytic anemias, where the size of RBCs is big, is usually due to defect in DNA synthesis. Normocytic normochromic anemias can be due to various reasons, where sometimes the clue lies in the shape of RBCs. Laboratory indices help to quantify these observations. Mean corpuscular volume, or MCV, is a measure of the size of RBCs. Mean corpuscular hemoglobin, or MCH, is a measure of the amount of hemoglobin within the RBCs. RDW, or red cell distribution width, basically looks at the size difference of RBCs. At this stage, understanding what these parameters mean is more important than memorizing the normal values. Regardless of the cause, anemia produces symptoms due to tissue hypoxia, which includes fatigue, weakness, dyspnea on exertion, and on examination pallor. In severe cases, anemia can also affect the heart, kidney, and brain. For now, the goal is not to memorize individual anemias. The goal is to understand how anemias are classified. Once this framework is clear, individual anemias become much easier to understand. In the next video, we'll look at anemia due to blood loss. Think at the cell level.